Hi, I'm Dr. Alan Kadish, President of the Touro College and University System. I want to welcome our students, faculty, and staff back to campus as the COVID pandemic evolves, even though it's not completely gone. We're excited about getting back to something resembling normal education. Historically, vaccines have had a major impact on public health. Diseases such as polio or smallpox, which devastated society, have now been controlled or eradicated because of viral vaccines. The two most commonly used vaccines in the United States use new technology developed over 20 years ago and has been refined to the point where it worked superbly. As we approach the fall semester, we want to make sure as many of our students, faculty, and staff as possible are vaccinated. In the past 18 months, Touro has faced enormous challenges. Through all of that, I'm very proud of our faculty, our staff, and our students in what we've done to keep things going and keep our students, faculty, and staff safe. It's been a tough year, but our community has risen up, worked together, and made a real difference, not only in our own lives, but through volunteering efforts in the lives of others.
Hello, I'm Dr. Robert Amler. I'm happy to talk to you today to dispel some of the myths that have come up with regard to the COVID vaccine that is now being used so effectively around the country and around the world.
The vaccine doesn't work.
Well, if you say the vaccine doesn't work, say that to the millions of people who have not gotten sick during the last 4 or 5 months that the vaccine has been out. Look at the dramatic drop in COVID cases since the beginning of the current year, 2021. We were masking and being careful all along, but the difference was when people started to get vaccinated. So empirically, the vaccine not only works, it works really well.
The vaccine will change my DNA.
That's another common question. The vaccines do not contain DNA. They don't interact with your DNA, so they can't change it. Instead, they contain what's called a messenger RNA, which is different from DNA. And even then, it's a small piece of RNA that simply teaches your cells to make a protein that stimulates your immunity to COVID. There's no COVID virus in the vaccine, there's no DNA in the vaccine, and the material that is in there does not interact with your genes or your DNA.
The vaccine was developed too quickly.
That is not accurate. The vaccine actually is the result of many years of development of vaccines against coronaviruses. What's happened in the last few months is the vaccine was made more specific and more pure for the kind of coronavirus that causes COVID. But the vaccine development has not been a race. It's been a slow, progressive development.
I don't need to get the vaccine if I've already had COVID-19.
The vaccine gives you a more permanent immunity. If you had COVID infection a few months ago, you still should get vaccinated. There are plenty of people who get infected a second time, but very, very few breakthrough cases of COVID after someone's been vaccinated. So if you want to be immune, you are far better off getting the vaccine. We appreciate how much the Touro community has come together, stayed together, and supported each other during difficult times. Let's face it, we are all in this together. Infection is still out there and dangerous. Vaccines are an important step to protecting all of us, our friends, our family, our loved ones, and our colleagues. Help keep Touro strong.
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 Help keep Touro strong.